Bryce. It's nice to meet you.
Hello, nice to meet you.
Yep. So today I'm gonna interview you about your experience on acupuncture and on your thoughts of integrating traditional medicine into modern medicine. Okay?
Fantastic.
So can you please describe your role and how long you've been practicing and your connection to traditional healing practices?
Sure. Well, I'm a licensed acupuncturist. I've been practicing for about 14 years now. My training, there's a handful of colleges you can go to study traditional Chinese medicine. And it's usually a 4-year degree, master's level. And once you finish that, you have to complete 3 national exams before you can apply for any medical license.
Okay. And could you go more in depth about what those national exams entail?
Sure. So we definitely, there's a exam on just the point location and safety, and make sure you know where those are and what they do. Next is the theory of Chinese medicine that's behind it. So we look at the body a little bit differently than Western medicine. And then the third one is there is a Western medicine section to it as well. So we need to understand modern medicine, diagnostics, and things like that. And how do we translate that into how the traditional Chinese medicine views things.
So how did you first become involved in acupuncture?
So I grew up with a fascination with martial arts.
Okay.
So from a very, very young age, I would just read anything I get my hands on about different martial arts. And through the years, I became very fascinated with what they call the internal martial arts.
Okay.
So there's 3 out of China called Tai Chi, Xing Yi, and Bagua. But Tai Chi, for example, starts talking about these energy systems, and there's all these stories of these smaller, older masters that could throw young pups across the room.
Yeah.
And so I dived deeper into that, and then that was my introduction to these energy systems and how it can be used for healing, and then acupuncture. And I got to a point where I exhausted all my resources and I couldn't find anything else to read, but I still had this thirst for knowledge. And so I decided to kind of quit my sales job at the time. I moved halfway across the country and just took a dive into learning about acupuncture and Chinese medicine.
Oh wow. Did you ever practice any martial arts besides like the internal martial arts?
A little bit as a youth. I did a little bit of Taekwondo, but I did a little bit of Tai Chi, but it's hard to find really good, someone who knows the internal energetics of it. That's the hard part.
I see. Well, in your view, what makes acupuncture effective?
So because we look at the body through a different lens, we see the body as these little ecosystems that are trying to work together.
Okay.
And so we're reestablishing this communication pathway so that way the body can naturally take over and deal with whatever pain or disease that we're trying to deal with. So that's, I think, the biggest difference between how I view, or Western Chinese medicine views the body and disease versus Western medicine, where if we get the system healthy, then it can deal with most things that we can kind of throw at it naturally.
So I was told that acupuncture, there's many different styles of acupuncture, like Korean acupuncture,
yeah,
Chinese
very
acupuncture,
good.
right? So, and every practitioner, you could say, has a different interpretation of how the practice should be practiced. So, how would your interpretation differ from, the central dogma?
Sure. I am pretty close to the traditional Chinese version of acupuncture. And so we definitely get more of a sensation from the patient. That's kind of the biggest difference. And then the majority of the points, like the major points that you can use on the body and that they're named multiple times for different reasons, tend to be more from on the limbs, from the elbows and knees out.
Okay.
So I guess that's how I would differ. So most of the points I use are going to be more on your limbs, your arms and your legs, and I can treat the whole body that way.
Okay.
In school, though, the kind of standard way is there's points all over the body that you could use on the chest and the back and things like that.
Now, more about the people that come in here for acupuncture, right? How do they usually view modern medicine?
Most people have not had a very good experience with Western medicine.
Okay.
So they've either dealing with a pain or some kind of disease for a long time, and it just seems like they're not getting anywhere. So I usually see people after they've exhausted resources
Okay.
first.
I see. Well, what about those that try to combine a Western medicine and traditional medicine? How do those fare?
That's the best outcome,
That's
I
the best,
think.
okay.
Yes. So I definitely, I like to work with the Western medical community when I can. The biggest hurdle is education. So Western medicine just doesn't understand what acupuncture can do and how we can kind of treat the body, even if there's these wacky symptoms, but no official diagnosis. We're still able to still treat the body.
So I want to ask, like, how do you think acupuncture not only addresses physical health, but also mental and emotional health?
Absolutely. So we're dealing with the nervous system a lot.
Okay.
At least that's how I view it. And really, we get the most healing to occur once the body's able to downshift out of this fight or flight state. So we have all these stimulus that is trying to push us into more of this fight or flight response. And if we're able to downshift into more of this rest and digest, then the body is able to more quickly rebalance and start to heal itself, and we see a lot more pain relief more quickly.
I see, that's good. So now going back to those that you said that a lot of people, they first go to Western medicine, right? And then they come to you for more help once they've exhausted their options. Could you give me an example of a negative experience that they had with Western medicine?
Some of the times they've had all these different tests and there's no real conclusive answer of what's causing their pain or their discomfort.
Okay.
I guess the most common researched pain that I see is low back pain. That's kind of the most documented. And there are cases where people come in and they've tried all kinds of different